everybody. Welcome to JMBE Live. We have a special episode today featuring some authors all the way from Singapore. I'm Rachel Horak. I am staff of ASM in the Education Department, and I'm coming to you from the East Coast of the United States. Today's presentation will be a discussion of the paper called Lockdown, Learning Public Health of Infectious Diseases Through Gameplay. And in a moment, I'll post the URL to the open access article into the chat box so that if you haven't read it already, you can read the article. And just like all articles in JMBE, the Journal of Microbiology and Biology Education, it's free to read for everybody. So let me take a moment to call your attention to some really exciting events that we have coming up this year. The first is the ASM Conference for Undergraduate Educators will be in person again this year. It'll be November 15 to 17 in Pittsburgh, Pennsylvania. This will be an entirely in-person immersive learning experience where we can meet other educators, share teaching strategies, and share your own scholarship about teaching and learning. So you can scan the QR code to learn more about the conference. And we will have registration available sometime next month in April, and the early bird registration will be in the middle of September. A brand new offering that we're going to have the opportunity for this year is called Mini ASM Conference for Undergraduate Educators. And this is also an in-person conference, and it'll be the last day of the ASM Micro meeting in Atlanta, Georgia. It'll be on the Monday, June 17th, 9:30 to 2 o'clock in the afternoon. And the most exciting part, it's entirely free. And we do encourage, if you are coming from the Southeastern United States, this would be a great opportunity to come and hear some of the latest research on teaching and learning, meet some more colleagues, and get a feel for what ASMQ is all about without having to commit for a multi-day conference. So do scan the code if this is an in-person only event. So if you think you might want to join us, go ahead and scan the code and register. Let us know that you'll be there. Finally, just a reminder of what JMBE is all about. We're for science educators like you from all around the world. It's rooted in the biological sciences and branches to other disciplines. It publishes original, previously unpublished, peer-reviewed articles and provides open access content. So there's the URL at the bottom. And again, I'll put the web link for this paper into the chat once we get started. So for our event this evening, I am delighted to bring in the editor-in-chief of JMBE, Stanley Maloy, who's going to engage in a conversation with the paper's authors. Stanley, take it away.
Thank you very much, Rachel. It's really nice to be here today. And this is the first time we've ever done this with a group of international authors. So it's really special, I think, for us on JMBE Live. But before we begin, it'd be really nice if the two of you just gave us a little bit of your background, because I think it kind of shapes thinking about what you did here. So, Anna, you want to start?
Yes. Yeah, hi Stanley. It's also very nice to be here and be able to connect from Singapore. My name is Anna Szuecs. I'm a medical doctor. I did my medical training in Switzerland, lived in the US, in Pittsburgh for a little bit, and then moved to Singapore. And my field is mental health, psychiatry. Right now, I work as a postdoc, a research fellow at the Division of Family Medicine at the National University of Singapore.
Thanks. And Yann?
My name is Yann Boucher, and I'm a microbiologist. I'm French Canadian, and I trained at Laval University for my undergrad, and went to British Columbia in an exchange to learn English, and then Dalhousie University with Fort Doolittle for my PhD. And then I worked, I did a postdoc in Australia, in Sydney, and also in Boston at MIT, before starting my lab back in Western Canada at the University of Alberta, where I did that for about 9 years. And then after that, I moved to Singapore at the same university as Anna in public health. I've studied cholera, mostly Vibrios, and I studied gastrointestinal illnesses, mostly.
Wonderful, thanks. Well, so I think that when you think about what you did to develop this game that's tied to COVID, the two aspects of both of your training, I mean, I think it's really obvious. You have the infectious disease and you have all of the psychosocial impact that comes in to dealing with COVID, right? And so I really liked this paper. I thought it was a really fun tips and tools paper in JMBE. And it also got some really nice online airplay with people really talking about how fun the game was. So why don't you take us through what you developed and why it's so cool?
I mean, I can I'll start the first bit and then maybe you take over because so basically, I mean, I moved to Singapore exactly like 1 month before COVID started. So, and Singapore had a very kind of strong response, right? They had lived through COVID #1, right? So in the 2000s, so they knew that this could be bad. So they did a strict lockdown for a month. I think it was 6 weeks or something like that, where you still had to go out of your house, but just to buy food, and it was very restricted. But I had a 5-year-old daughter at the time, and I was also knowing that I was going to start to teach public health, which I wasn't too used to because I was teaching general micro before. So I was like, okay, I've done some games in general micro, worked really well. I had a game on the type 6 secretion system for the whole classroom. And I wanted to create something for public health that would work in the classroom, but I also wanted to entertain my daughters because she was, literally biking in the apartment, running around in circles. So, I thought about this game for a long time, and there was this French game about car racing that I knew from when I was a kid. And any people from France or from French Canada or Switzerland, and they know about this game. It's a car racing game, card game, called Mille Bornes. I don't know in English. I think there was a version in the state called Touring, but it's not very well known. It's in the 50s, and that concept, I thought it could apply very well to public health because you're trying to race your opponent. You put blocks on them, they find solution, and I thought this works with public health. So I drew some terrible graphics and printed on paper. And I'm very bad at art, and I played with my daughter, but she was liking it. But then eventually, we live in a complex of faculty housing at the university, and I met Anna. Do you want to?
Yeah. Okay. So I also moved to Singapore actually right before COVID in January 2020. So it was just like starting out. And I moved from Switzerland at the time where I was working as a medical doctor. And then part of me felt a bit guilty about, all my former colleagues, being at the front line and giving it all to just, manage that like really, really crazy situation. And then I was in Singapore. We had a very comfortable life, but I wanted to do something for, something that could have an impact. And then we met walking our dogs and then started talking. And like one of the topics that came up it was that I was doing graphic design as a hobby. And that's one of my hobbies. And Yann told me about the game. We played it with his daughter, and then I basically did the graphical part so that it could be like a real game, not just with stickmans as it was originally.
I remember you showed me. I showed you my terrible graphic, and you showed me a picture of your dog that you'd drawn. I was like, "Wow, you're a good artist. I need your help."
So it was also a really nice project for me to have during the COVID period. And I think then we also worked a lot together on the rules and then how to adapt this game, because the original card racing game was from the 70s or even 60s, I think.
Oh, 50s even. It's very old.
It's an old game, and it was a bit slow paced, a bit, yeah. And so we need to make some adaptations to just speed it up, make it more digestible for a modern audience. But I think in the process we also made it better and probably better suited to the topic that the game is about.
If you want, I can show the cards. Is that a good time to do that?
Absolutely. Let's see it.
You want to switch the camera?
Yeah. I'm switching the camera here, and Yeah, you're good to go. So
Yeah, okay, great. So this is how the box looks like. We try to design it to be simple and affordable. Or maybe we forgot to say it, but we decided that we was going to give all the profits to charity because my boss, the dean of the School of Public Health, he just offered to pay for the game to be printed, and he was okay with that. And we really wanted to help and feel useful, so we're giving to a children's charity in Singapore. But yeah.
It's to the red pencil. It's not.
Red
they
pencil.
are not only working with
That's
children.
true.
They work with the whole population, actually, any age range, and they do. Yeah, basically, it's art therapy. So they do art therapy, and they did a lot during COVID as well.
Yeah. So this is the wonderful virus that Anna drew. I really like that one. So I'll just show you the different cards and just explain a little bit. So the basis of the game is it's almost as if you're the government, and you're trying to save as many COVID patients as possible, right? And we designed it to teach different public health principles, but also about the symptoms. Because if you notice on these cards, each of the little character, the patients have a different symptom, but they're all real symptoms of COVID. Because I remember back then it was a big deal, like you couldn't smell something, or all of the dry cough and all these different symptoms. So we wanted to teach about that a little bit. So the goal is to save as many patients as possible. So for that, I'm just going to switch to. So your opponent is trying to stop you from saving patients. So they're going to put some obstacle on you. So all of them are meant to be real challenges that we faced during the pandemic. So for example, supply shortage. I remember in Singapore, we ran out of ethanol gel and masks at the beginning. You couldn't get any. Then it was a big deal. Everybody coming in the country was the same in the United States, right? Having problems with case being imported. Then community transmission came in, and then there was too many people in hospitals, and also there was a shortage of nurses because they would get sick, and so we made all these different obstacles. So your opponent puts these obstacles on you. And just a little aside, this one in particular, I like that card because my sister-in-law passed away during COVID, and she was a nurse. So Anna made a nice depiction of her. She had a funky haircut. She always had pink hair, but we didn't put pink in the cards. So you've got the obstacle, and then the person is trying to solve the problems, right? So there's different solutions to these problems. So we have a corresponding matching sign. So for example, even people that don't know how to read, or different languages, right? You could do because you just match the symbols. So this one, for example, if you've got a problem with imported cases, then one of the solutions is traveler's quarantine, which is something that was applied in many countries. And so you've got all the matching solutions to the problem, and they have a matching symbol. So you use those to stop the problem and then be able to save people again from COVID through your hospitals. And then we have another level of solution, which are cards that you can acquire, and you buy them with some of the solution cards. And then you keep them for the whole game. These are more drastic solutions, and we're all familiar with those. For example, they would just ship hospitals at some point in the US, and that inspired me to do the emergency hospitals. Also, there was I can't remember what it's called in the US, it's called but we called it Emergency Production Act, where the government would provide resources to produce materials. Then the national lockdown, which was very unpopular in different places, but really saved a lot of lives. And then we created the game before the vaccine was what existed, but then at the end of the game, it was starting to come out, and they were vaccinating hospital personnel. So we added this card, and then the travel ban, of course, that happened in lots of countries. So these are more permanent solutions. It's to teach people about different levels of intervention that you can do. And then we thought, in the spirit of international collaboration, that we made this special card. Basically, it forces your opponent to help you out. If you have a problem and they have the solution in their hand, they have to play it to help you out. We thought we needed to add that because that was an important part of solving COVID. We can switch back to the.
Yeah, maybe do you want to just add a short explanation of how what you actually do during the game?
Oh, okay.
So maybe. Yeah, so you have cards in your hands that can be either patient cards,
like these ones.
Yeah, or trouble cards, which are the red ones that you
like this.
keep so that you can play them on somebody else's game. And then you have the yellow cards, which are the shorter term solutions. And what you do is that,
this one.
that one. So on your turn, you try to put a patient card on the table if you can, because the goal of the game is to heal as many patients as you can. There are so in the rule book there is a target to reach, and that varies with the number of players who can play, who are playing, because actually this game can be played with any number of people between 2 and 6, which is also one of the I think the advantages that if you have a larger family, or if you're playing this in an educational environment, then it still works, and you can play it solo, or you can play it in pairs, and then you just partner up with somebody else, and then your base of healed patients is basically the same, and you're both putting patients down in the same healing area. And so basically that's the game. So you try to impede other people's progress in healing patients, and at the same time, each time, so if somebody puts a trouble card on one of the red cards on, Yann, can you just show one red card on the, perfect. Yeah, so if you put a red card on the on somebody else's healing patients, then that person cannot put down other patients in that healing zone. So then they need to solve that problem first. And so they can solve it with a yellow card, and that takes care of the problem. Or they can, if they have the means, then they can purchase a green card, and then that will solve the problem for the rest of the game. And if they are really stuck, then they can also basically spend patients that they won't be able to heal to get the international collaboration card. So this is meant to be kind of just really being desperate and asking other countries for help. And if they play that card, then the opponents are forced, they are obligated to help them. And if they have a card that can help the situation and unstuck them, then they will have to play that card. So that's how it works. And then the first person or team reaching the target number of patients they need to heal wins the game.
And we made it faster paced. We can probably
I think I'll switch back now to our faces.
We made it faster paced so people can play twice in their turn, so they don't feel like that they're stuck, that they can get out faster. So we had some gameplay testing, and my daughter was one of these game tester, and Anna's family as well. All over the world, we had people helping. Some people in the States. So it all helped out. And then there's a gaming company, a local gaming company, that helped us print the games, and then distribute them through the local version of Amazon, which is called Shopee in Singapore.
And Shopee distributes around the world. If people wanted to buy it.
You can actually buy it through the company's website. It's called Capital Gains, and they can ship it throughout the world.
Okay.
But just a self-serving advertisement. I'm going to be at and Anna as well, going to be at the ASM conference in Atlanta in June, and we reserved a booth to sell the game. So if you want to get your own copy locally, you can just come and see us there.
I actually had a copy, but I gave it to the reviewers, and so I don't have a copy anymore. I'll have to buy one in Atlanta.
All right. I'm looking forward to see you.
So how long does the game take?
It can be pretty quick, right? You can go through a round. It varies, but it can go from, 10, 15 minutes around.
20,
probably.
Yeah, we put 20 minutes on the game. Also, budgeting in time to read the rules and everything for people who have never played before. But once you know the rules, it's really 10, 15 minutes. And this is the same amount of time for adults as for young kids. We tried it in Yann's daughter's primary school, and the kids picked up on the rules very quickly too.
I can just be in a classroom and I supervise a couple of games, and they pick it up right up. In an undergrad class, I use it to like an icebreaker in the first first or second class, you know, and you group students 4 to 6 together, and then they play. I just go around explaining it, and they catch it really quickly, and then they start talking to each other, and it helps for group work later on in the class. So that's very good for an icebreaker.
Could you say something about how you shift from having fun playing the game in the classroom to the learning experiences that you get out of that?
I mean, I can probably speak to that more, but so basically, I mean, when the people are playing, you can pay attention to the details, but you don't always. But then you can go and look at each card separately, and you can, okay, you know, what does that mean, and did that happen in real life? And then people can refer to their own personal experience, because we've all been through the pandemic and felt the pain, right? And we all had to go through one of these responses from the government, or we know people that got sick, right? So you can relate to people's personal experience, and then you can relate to the class material, depending what you're teaching, through the cards, right? Because each card represents an intervention, which has some policies behind it, which has some microbiology behind it, right? If you look at, you know, contact tracing and community transmission, then people can connect what part of the virus matches of the virus's biology matches what type of intervention. It's also good for public outreach, because when family play this, you know, there's often kind of heated discussions in family, and these things get political even though they shouldn't be, right? So it's kind of an easy way to discuss these things, because the children can talk to their parent about it when they're playing the game, and learn about the basic logic between each type of intervention.
Yeah, and I think from a more psychological perspective, we wanted the player to be the government in this game. So, you know, instead of being the frustrated public who cannot go out, cannot do X, Y, and Z, now you're the government, and you need to heal people, you need to protect your population, and then you have these measures you can do, but there are only a limited amount of number of them, and so we wanted people to be in that mindset, and we thought that this in itself could help them understand better also what were the government's obligations and difficulties. And then what I wanted to add as well is that sometimes actually with little kids, so in families or in more primary school environments, the children notice a lot of details themselves, because they will really look at the cards, which we tend not to do anymore when we are adults. And then they will ask about details themselves, or they will comment on them. And those can be really good entry points also to discuss actually more abstract public health measures or biology concepts.
Yeah, my daughter became a bit of a mask advocate at her primary school after playing the game. Yeah.
So that's really an amazing thing, because most games that are made by higher education people are focused on a college classroom, right? Like, I imagine a type 3 secretion system game probably doesn't apply to the general public, right?
No, definitely not.
Right.
Even undergrad, it's
right. This game really spans an amazingly broad group of people and reaches each of them in a somewhat different way, huh?
Yeah, I mean, I do miss the undergrad, something a little bit more applied. We'd like to do that in the future as well. And we actually started working on it, but then we got distracted by our day jobs. About teaching microbiology, actually, and I'm pretty convinced you can teach up to 20% of a curriculum with a card game. That's a challenge I put to myself. I think it'll be a few years before we come up with that. But I think there's value in different types of games, right? Based on your target audience. This one, I think, there's a huge value for the general public, and also kids that are primary, secondary school, and even undergrad. The undergrads are probably not going to learn as much, but it's a good way to kind of break the ice and enter the concept, and then start a more complex discussion that undergrad classes have, right? Yeah, so I don't think I expected it would be that broad ranging when we first created it. At least I didn't. I don't know, maybe you did. But I was happy to see that.
Yeah. Well, I think the game also grew as we designed it, and then we more and more people took interest in it, which was really nice to see. And yeah, I think that it's definitely a fun game. It can be a party game. It can be a family game. It can be an icebreaker game. And I think that in itself sometimes is overlooked, that if people are having fun, then they will memorize concepts better, because then those concepts will be emotionally salient for them. So.
Yeah, and it's also mnemonic, because you see an image and then you remember the meaning of the image. I mean, that's a strategy we often use in undergrad classes, right? So this is very powerful in that sense. Yeah.
Have you actually measured that yet? Have you measured the learning outcomes associated with the card game?
So we didn't put that in the paper because I wanted to do it, but it never came together. But I think I'm definitely going to do it. The school my daughter's at now, they're very open-minded. It's the United World College Southeast Asia, and I'm pretty sure I can convince some teenagers in the high school there to actually pick that up as a science project. And then I've got some masters in public health student now. They design questionnaires and things like that for educational outcomes. And I think we can do that like a sort of a before and after in terms of knowledge. Something like that. You can target different populations as well. So yeah, that's definitely in the cards to try to measure that. I just haven't had the chance to or the time to organize it yet. Yeah.
I think that would be really particularly interesting because there are a number of people who've tried gamification for different things. Let's just say type 6 secretion system, right? But it's pretty specific. And in this case, it's very interesting that you could actually look at learning outcomes from different levels of society, right? And I think that will be, to my knowledge, of all the gaming papers in education that I've read, I think that is really very unique.
All right. I mean, it's good to hear that. That's definitely something we wanted to do.
Yeah.
Go ahead. Yeah.
Yeah. No, I definitely think that we could bring this further, and then also measure what works, what are the aspects of the game that work in different populations. I would be very interested in that. Yeah, so hopefully we will be able to do that in the future.
So I'll submit for a Masters of Public Health project to do that then. I think they're coming up.
So I'm just a little break in things. I want to tell people listening in from the outside, please, if you have any questions, post them in the Q&A and we'll talk about your questions. So don't be shy. Go ahead and post your questions as soon as you have them, right? So one other thing about this is you built it specifically for COVID, and specifically, I think, because the lockdown, in fact, was so oppressive for so many people, right? Does it still resonate now that a lot of that's been relaxed? There's a tendency to say post-COVID, but I know better than that. But a lot of those regulations have been relaxed around the world. So how's it work now?
I mean, I think it because it applies more generally to a lot of respiratory infectious diseases, right? It was designed around COVID, but a lot of the responses would be similar for others. And as you know, there's other diseases that are coming up, like Mpox came up, right? So I think it's still on people's mind, and it kind of, even though other diseases would be different responses, I think some of the principles still apply, and I think people can relate that because now it's in everybody's consciousness. So and we're always watching for the next disease that's in the news. So I think it's staying relevant in that way. And I think nobody's going to forget about the lockdown. Now, whether people are too traumatized to play a game about the lockdown is another question. I think I've heard that from some people, but most people, because it's a subject matter they're familiar with, then they get interested in the game. And almost everybody's got some level of familiarity with these measures, right?
I remember that when we were designing the game and when I was making all the drawings for it, we were trying to hurry because we were worried that after the pandemic is over, nobody will want to play that, or
I remember
outdated.
My boss, Yang, the vice dean, he told me you better hurry up with your game because COVID's gonna be over, and we're like. In retrospect, it was another 2 years. There was not a real worry, sadly enough, right?
Yeah.
Right.
So I think sorry, just to add to a last bit about this. So I definitely think that it was, obviously more relevant during COVID times, but at the same time, I think it also like the game's dynamics and the mindset that was behind it. I think that should be also maybe applied to new games and like other games that are in the same vein. So we definitely learned with it, and then it's, if people are still having fun with it and can use it, that's great. And yeah, I think at one point we probably also need to come up with new things.
So one of the listeners asked the question, what's the price of the game? And it would be also nice if you would just say one more time where you can buy it from.
We can maybe put the link in the chat, right?
Yeah, we can do that.
Would be very helpful.
Try to.
Yes, it's Capital Gains Studio. If you look, you can find a link on the web. If you just enter actually the name of the game, Lockdown, an educational card game, you'll find a link for buying it internationally.
And so there is a shipping fee. So that's just something to be, then unfortunately, that distributor had to put in a shipping fee for the game. But yeah, it's still, so even though if you order several copies, I think that's fine. If you only want one copy, then it may be a bit more challenging to, it would definitely add to the price, unfortunately.
So it's 25 Singaporean dollars. I think it might be 20 US dollars. It's a bit more than you pay for a game or something like that, because of you don't print as many copies, you're not the same throughput. And also we wanted to make sure that we gave enough money to the charity that it was worthwhile as well. So that's why it's a little bit expensive like that. But it's about $20 US, yeah.
And I'm not sure whether I can. I think I can post it for everyone. Yeah, sorry, I'm just trying to figure out.
And I will just warn people that you cannot get it on Amazon. Don't buy Lockdown on Amazon. It's a totally different game about monsters and demons. So
just come to ASM and buy it from our booth. Maybe in the future it'll be on Amazon, but yeah, when we have more spare time.
Yeah.
Oh yeah, Rachel found it before me. Okay, good. So we have it on the chat now.
So one of the other listeners asked the question. They said, it's a beautiful game. Could you please comment on how the game has been refined and redesigned since your first iteration? What worked and what didn't work?
Okay, yeah. So maybe I can go to the table now to show some of the cards. I think that can be helpful. Can you switch the camera, please? So yeah, perfect. So well, that one difficulty I faced when designing this game is that COVID is not a fun topic in itself, but we wanted the game to be fun. And at the same time, we didn't want to minimize like how COVID was impacting people. And so that's why I chose this like more pastel toned card colors. And you can see that these patients, they are a bit creepy looking. Like they are cute, but they are also a bit like they look ill.
I think the game design studio, they called it Euro Noir style.
Yeah, they called it Euro Dark.
Euro Dark.
Because here in Singapore, they love brighter colors. So
and happy, cartoons.
The distributor said it was a bit Euro Dark, but well, it probably matched the era as well. One other thing that I wanted to put in little details that really could be important when talking about COVID in general or the pandemic. And then Yann mentioned that each little character had a different COVID symptom. I also wanted to make sure that they were not from a well-defined ethnicity, or they didn't identify any age groups or like any other population groups. I wanted people to be able to identify with them, but also not making them too realistic, so that it wouldn't be like too sad or anything.
So some of the characters are funny, but they're not laughing or anything like that because it's a serious subject matter. Yeah.
Yeah. And there are little, there are little details. For example, here these are the like all the cards from the community series. I can show you, for example, these two. here you can see the like Singapore skyline in the background. So there is a little bit of just a tiny hint to the fact that we were in Singapore when designing it.
We almost called the game Circuit Breaker because that was what they were calling it in Singapore, but then we realized internationally people wouldn't understand why it's called Circuit Breaker, so we changed the name.
Yeah, and then, so basically the design evolved. The first cards were really just stickmen. That's what I got from Yann.
It was really bad.
And then I made some first characters. I think really the very first character I designed was this character here. And of course, the back of the cards, I designed this virus that looks a bit sneaky, but also, not mean in itself, just
a little edgy, right?
A little edgy, yeah. And so these were the two first things, and then the rest kind of like fell into place, and then we would like show them also to people around us. Would discuss the designs together, and I think I managed to scale up my graphic designer skills also throughout the process. So it was a good learning experience for me as well.
Oh, she was amazing. She did all the instruction manual is one thing that's especially tricky. I think.
Yeah, it's here.
Okay. And
then we tried to make it compact. So we didn't want one of those huge game boxes. So the instruction manual in itself is also very compact. It's just like this this little piece of paper that's like printed on both sides, but yeah, it's also really really easy to carry around, and there was I think we put a lot of thought in it throughout the different phases.
But it was an iterative process. So first it was game testing with people we knew, and then as the game the graphics evolved, we tested it broader audience as colleagues. And also then the Capital Games company that printed the game had some feedback for us because they know a lot of gaming, and they helped with making the game faster, more dynamic a little bit with their advice.
Yeah, maybe also one other point is that so we also didn't want to target any specific region.
Wanted to be international.
Yeah. So for example, this is the imported cases card. You can see that the imported cases can come from like warm countries, but also cold countries, and also we tried to make it in a way that even colorblind people could still play it, even if they don't see all the differences between the colors of the game. So if we have little symbols, so all the trouble cards have this symbol, this little plus sign here. So there are things they can use to orient themselves if they cannot see differences between colors.
And the symbol that are matching for the troubles and solutions are very useful for children that are younger that don't necessarily can understand well. So for them, it makes it very quick.
That's a very nice explanation. So Somali said, I think the overarching concepts covered through this game will stand the test of time. She said, would you agree? But I've already heard you say, yes, you agree.
Well,
I would agree.
Yeah,
sure.
I hope so as well. I think, it's also important for people not to forget about history. So not about like more remote history, but also not about recent history.
Because I can say for sure that Singapore going to SARS-CoV-1 in 2000 was very helpful for the response, almost 20 years later. They were prepared. They even had created a hospital just for that. Every person that even gets some COVID symptom and they would be sent to that hospital. As the case rose, that wasn't possible anymore, but they learned from it. And I don't think we should forget about what happened. And so be more prepared next time and not make some of the same mistakes, right?
So most of the students you're talking to weren't born then, the first time, right? And so, Somali asks the question of how does the student feedback compare now versus back when we were in the real throes of COVID-19?
So I didn't play it in the classroom in the real throes of COVID-19 because it was all online. So I haven't made an online version yet. So I only played it afterwards, so I can't really tell you the difference. And I'm not sure during COVID it might have been a bit raw for most people to play the game. I think it might be a bit easier after the fact. Yeah.
Yeah, during COVID, we were thinking a lot about families,
Yeah.
not having as many opportunities to do activities outside of their homes, and so we were thinking that that would be maybe a fun way to spend time together without looking at a screen.
Yeah, that would certainly help me with my daughter. I spent a lot of time in the apartment playing that game.
So Lily asks, is there a trick to winning the game?
There's a lot of luck involved as well. And I think, all games have a ratio of strategy and luck with them. This one has some strategy, but there's a lot of luck. There is, I think, put the high number of patient cards first if you've got them in your hand. Quickly, so focus on these high just to get them down. And don't always focus on being nasty to your opponent, like putting your cards down, focus on that. And then if your opponent's getting too ahead, then you can be nasty with them, but don't focus on that too much. That's what I would say.
Yeah, I guess that's good. And then we also invest in the long-term solution.
Yes, as well.
Because they will help you along the way. And don't be shy to ask for international collaboration when you need it.
Yeah.
So Jamie asked the question of, as you learn from the game, would you ever put out a second edition?
So I think my boss asked me for like a luxury edition with like golden shiny boxes, but for like special VIPs, but I don't know if we'll do that. We shut him down the first time. But I don't know if there's much that I would change about it, to be honest.
Yeah, I think this game is nice the way it is, but we definitely have appetite to do more games, educational games, and maybe use this experience to design something that's even more interesting in the future.
Yeah, so that's more where our effort would go, not so much into putting a different edition, but into creating a new game. I think targeted mostly microbial physiology and also a little bit of climate change as well, how it affects microbial communities. So something like that. We've been sort of toying with these ideas and playing with some concepts, but so that's more where our effort's going to go in the future. Yeah.
I think that the microbial communities and climate change is another thing that would resonate a lot with people right now and help people understand a complex concept, just like with COVID, right? And so I love microbial physiology, but I think that the other one in particular could really be a wonderful niche, right? That changed the world, right?
Yeah, no, I think it's very interesting. And this is one topic I research now, looking at the impact of climate change on the water temperature and Vibrio population being directly correlated with water temperature, right? So infection rising in the United States, that is going more and more north, how much vibriosis you can get from being in the water, and also cases of food poisoning. So there's direct correlation definitely with several infectious diseases, but also like vector-borne diseases like mosquito-borne. The niche of the mosquito changes with weather patterns. So where these diseases are changing. I mean, the United States is getting some tropical disease now that they weren't seeing before. So I think this is very, very relevant, and it could change very fast the dynamics of those diseases.
Yeah, I've got a seminar on that too.
All right. I'll make sure to tune in.
So one of the things I was going to say is about your boss giving it away to visitors. University administration, whenever a visitor comes, they give them something like a fancy plate or a fancy book. I think they would love to get a game instead. So
yes, so we actually put 300 game aside, and I think they ran out like really quickly within the year. So maybe we'll have to print some more. But one thing I got to say is that I found here the university administrator was very, very open-minded and very supportive. And I maybe I'm just lucky, but I don't think I could have made that happen, before coming here. When I talked about the idea, there was only support coming from me, and that really made a big difference, because I wouldn't have put my own money to get the games printed, and that was great that they were very open-minded to do that. So that I think when you have a supportive environment, that really helps with this type of initiative. Yeah,
that really is great.
I think
Sorry.
Yeah, it's good that it could come also officially from the university,
Right.
all that support. I think in the academic community in general, there are many. There is interest for games and board games. Like it's the type of nerdy things that academics do. So it's good that you could also find that in your school. Yeah.
So I'm going to jump, at least ask the question, do you get bonus points for getting to 10,000 patients?
So I remember, there's no bonus, but I remember the old game, Milborn, there was special rules, advanced rule that if you hit some combination in certain orders, you get points, more like traditional card games where you're scoring. But we decided against doing that because we want to keep it simple. But if I guess, like you're saying, if I did another edition, maybe I would put like pro rules for this type of special, could make it more exciting for more advanced players, perhaps.
Yeah, I think that, well, we also put the target so that, the game would be limited in time. So there is a target number of patients you need to heal to win the game. But I know people who just play until they, like whatever, they get bored of it or they run out of the draw pile, then they end it. But so nothing really stops you to play.
So Dunhong asked the question, are you considering an online version? Or if we have another lockdown, so you could play with your friends somewhere else. And Maureen said, can you make an app for the game? Those two things I think go hand in hand.
Yeah, I mean, I definitely thought about it. We even tried to get people to, program for free, but it kind of, they lost interest and it didn't happen. So for us, it's mostly based on finding the people willing to do it. So that's definitely something we talked about, but it hasn't happened yet because we just haven't found the right person. But yeah, that's a great idea to do that.
And we definitely need also more people on the creative team because yes, we also have our research careers, and it's I had more time during COVID to design the game, but not sure whether I will have that time for the next game. So
I was actually on sabbatical when I designed it, so I had some not so much pressures as usual, like no teaching or anything like that. But sometime in the university you find students, right? For our next game, we wanted to find art students. You suggested a business student to put it on Amazon or something like this, and probably computer science student to find them. I think they could be keen on a project like that. That's probably our best bet to do these things.
Yeah. I think that's a great idea. Those would be fun projects for students, and they would learn a lot in the process. You just need to make sure you have a computer science faculty member as a co-mentor. So
yeah, exactly right. That's true. Yeah.
So along the lines of other topics, Maureen said, what about antibiotic resistance as a topic for a card game too? It also fits into this concept.
Yeah, 100%. I already thought of the name for the expansion pack for AMR for microbe game, antibiotic apocalypse or something like this. So yeah, I've definitely thought of that because I do some work on AMR as well. Do environmental surveillance and also gut microbiome. So I'm very interested in that. It's an extremely relevant topic as well. So for sure, 100%. I think if we designed the game, we would start with a basic format of microbes sort of maybe fighting each other, and you need to keep them alive by giving them the right nutrients. And then you would have events happening. Anna and I discussed that, like the climate changes, or there's an outbreak, and then maybe you can use AMR to like antibiotics, but some microbes are resistant or something like this. So that we've been toying with these ideas, but for sure, I think that's a hot topic for sure.
Right.
Yeah,
well, one of the things I think that you've done is you've really catalyzed people to be thinking about this again. And so one of the nice things about it is that one of your impacts can be you'll stimulate someone else to generate games on a variety of topics, and they'll learn from the things you learned already in terms of making your game.
Yeah, actually, I'm been helping a colleague in medicine. He's doing a gut microbiome game and just giving him some advice on how to set it up and things like that.
Yeah, I was also just about to say that it's relevant for the microbiology field, but also for medicine. So it can really reach a large number of students and academics. And yeah, I think it's good. Well, definitely you can take inspiration from other games, like other educational games, but there are many just mainstream games in the, out there in board game stores that are really good sources of inspirations as well. And some of them are also actually very accurate biologically. For example, Wingspan has real birds that are featured. So if you play a lot of games in your free time, that's a really great source of inspiration.
Yeah. Well, so Anna, I'll just make one comment about you're saying that it also applies to medicine. Us microbiologists think that microbes apply to everything.
Yeah.
So
yes, of course they do. Geology, medicine, whatever.
right.
Yeah. Well, it's microbes are everywhere, so yeah.
Right. Well, this was really fun, and I'll just say I really enjoyed your game. It was a great. I really had fun reading the paper. It's been great talking to. JMBE has published a number of papers on educational games. I've only gone back to 2011, but a lot of papers and different things. And this whole concept of gamification to help people learn is such a valuable concept, and it's such an opposite concept from the way we thought about education in the old days, where you sit there and we pour information into your brains, right? So I think I really enjoyed talking with you, and I hope other people have a chance to get your game and have a chance to chat with you if they come to the microbe meeting in Atlanta this year. So that would be really good. It's been really great fun talking, and well, I'll turn it back to Rachel now.
Thanks so much for having us.
Yeah, thank you.
Yeah.
We had a lot of fun as well. Thanks.
I really appreciate our speakers joining us all the way from Singapore today. This was our first foray into having international speakers for JMBE Live, and it worked out. It was great. So really appreciate having you all here. And into the chat, I just put the link for JMBE Live's webpage. If you scroll to the bottom of the webpage, you'll find our next two JMBE Live events, and you can go register for them now. They are, again, free of charge for everybody. We have one on May 3rd, and then we have another one on May 17th. And the May 3rd will be biology education research around course-based undergraduate research experiences. And then the other one on May 17th will be about AI. So, that's going to be an interesting topic. So go register yourself for those free webinars coming up. Like always, we record these webinars and they'll be available on our YouTube channel. And so you can find that also on the link I posted into the chat for JMBE Live. And there's, I think, 30 episodes now. So if you've missed any of them, we've had episodes for the last 3.5 years. And also we do an episode at ASM micro meeting. So if you're coming to the micro meeting, come see us. We'll have a JMBE Live on Saturday on the main stage in the exhibit hall. And then we record them and also put it to our YouTube playlist. So thank you so much for joining us today, and we hope to see you at a future event. Thank you, Stanley. Thank you to our speakers today.
Thank
Bye.
you.
Thank you. Bye.